Can a pitcher heal from a rotator cuff tear and still keep throwing gas? Short answer, sometimes yeah. But the real answer, it depends. In this video, we're diving deep into what it actually means for baseball players dealing with a rotator cuff tear and whether you can rehab your way back to the mound.
Welcome back to the Mound Ready podcast, the show where baseball players, parents, and coaches learn how to protect their arms, build real strength, and get back to dominating on the field. I'm your host, Dr. Dominic Rangel. Let's jump into today's episode and get you one step closer to being Mound Ready.
What's going on, everybody? I'm Dominic Rangel, and I'm a physical therapist in San Antonio, Texas. First, let's talk about what a rotator cuff tear is and what is the rotator cuff. The rotator cuff is a group of 4 muscles, and their role is to stabilize the shoulder joint during any movement, but it's also the stabilizer that allows for high-level throwing mechanics. They basically keep your arm from flying out of the socket by overcoming more than your body weight and compressive forces. When we talk about a tear, we're not always talking about the same thing. You've got partial tears, full thickness tears, and complete ruptures. So what's the difference then? Partial tears. These are the most common in pitchers. It's basically small fraying along the muscle that doesn't cut all the way through. A full thickness tear, a bit more serious, meaning they cut all the way across the muscle, but not all the way through. But some can still be managed conservatively, especially if it's less than 50% thickness. Complete ruptures, that's usually surgical territory, especially if you're a competitive athlete. Usually, surgery is warranted if there's more than 75% in size. Now, the big question, can you keep pitching? Here's where it gets a little tricky. If it's a small partial tear, a lot of times you can do a shutdown period, rehab it, manage the symptoms, and keep pitching without surgery. We'll need to focus on rotator cuff strength, endurance, scapular control, and a progression back to the mound with monitoring. We'll need to address all other factors with throwing mechanics as we progress through the rehab process, and also test for other causes like leg weakness or power weakness. But if there's persistent pain, loss of velocity, or an inability to throw without compensating, it might be time to shut down and talk about the alternative. Because we know that these tears progress over time, so we have to monitor them once we know that they're there. And let me be clear, just because you have a tear doesn't automatically mean that you're done. I mean, many pitchers have imaging that shows damage, but are still able to perform because they're managing it well. For example, like 47% of pitchers in college have some type of articular-sided rotator cuff. Even crazier, 17% of Little League pitchers have some form of tear. It literally blows my mind. Rehab. Rehab the rotator cuff isn't just doing band work and calling it a day. If your rehab looks like that at the end stage, please find someone else. Here's what a solid program looks like. The initial phase, reduce the pain, control the inflammation, work on range of motion, easy, nothing crazy. Mid phase, target the rotator cuff and scapular strength, especially with eccentrics. Third phase, advanced phase, plyometrics introduction, but also advanced strengthening and stabilizing exercises. 4, return to throwing. You need a carefully structured ramp up, guided by your PT or your pitching coach, and use data-led progressions. Most successful cases will spend 12 to 16 weeks rebuilding before even thinking about picking up a baseball. But let's talk about the alternative. There are times when surgery is the best route, especially with a large, full thickness tear greater than 75% of size. Ongoing pain that limits daily activities and no progress with conservative therapy. Also, surgery doesn't mean your career is over. With good rehab and proper programming, I've seen athletes return just as strong. We can talk about this process in a future video. If you're a pitcher with shoulder pain, don't panic. Get evaluated. Get a plan. Don't rush the process. Rotator cuff injuries aren't a death sentence, but they do require respect and attention. And if you want more videos breaking down shoulder rehab and throwing recovery, hit the subscribe button. Drop a comment if you've dealt with a rotator cuff injury. I respond to every single one.